Hey, Dr. Ratcliffe here. We are starting part 2 of our functional medicine case review of Jemma. This video, we're going to go over her labs and see if we can gain some more insight to her case. If you haven't watched video 1 of Jemma, you're going to want to do that so you know more about her history before we proceed to her labs. Okay. All right. Real quick, I think I should review. She is a 2-time cancer survivor for breast cancer. She was recently diagnosed with, well, not recently. She had an autoimmune disease. She was diagnosed as Hashimoto's, but she also had a positive ANA and I think a CCP. So she had a history of cancer, and that's where we got so far. So here are her labs. So this is done by Quest, and first lab we're going to look at is her glucose. So her glucose is flagged as 60. If we look here, from 60 to 99 is the lab reference range. So if you can see my hands, so 60 to 99. If you're chronically 65, you're borderline hypoglycemic, and if you're 99, you're getting to the diabetic spectrum. So healthy, what we call the optimal range, is kind of here. So we got lab range, and we got a more narrowly defined kind of optimal range. So optimal is right around 85. So she is chronically running low. It was about in 2016, 2017, she was diagnosed with cancer for the second time. So her blood sugar is 60, which is low during that. Now, what's interesting, if we can see in this case, she tends to have a low LDH, lactate dehydrogenase. When that number is under 150, you are more likely to get some reactive hypoglycemia. And these are people who sometimes get a little hungry after they eat. Their body's using a lot of insulin to mop up the sugar. And then as a result, when they're trying to process it, the blood sugar can go down. And these people can get that. So we may have a hint into some of her case. So even with low blood sugar, when she eats, she'll have an insulin surge. Now, what's interesting, insulin surges, so even with a low blood sugar, she's going to eat something. Insulin surges can be a trigger for certain autoimmune diseases, especially the thyroid. We talked a little bit last time that Hashimoto's is the most common autoimmune disease, but insulin surges are a known trigger. Insulin is very inflammatory, and if you have spikes in them, you can certainly develop some issues. So you want a nice stable blood sugar. Also, too, she's very fatigued currently. When we get a chance to look at her most recent labs that I ran, here is her current glucose fasting. That's 92. That's a big departure from her norm. So something is stirring the pot there. So we don't know what that thing is quite yet. So anyway, she's got a low blood sugar. It's interesting too. You'll see hormone changes when there's changes in blood sugar, insulin sensitivities, and insulin surges. You will have changes in some of your brain chemistry, especially the FSH and LH signaling to the ovaries, and you can even develop some other endocrine disorders. So anyway, 60 is abnormal. All right. Let me see if there's anything I wanted to say more about low blood sugar. You can get an increased energy. So other signs of low blood sugar. If you get energized when you eat, that's not normal. We should have a nice steady state of feeling relatively the same. Food shouldn't make us feel like a ton better, and it shouldn't make us tired too. If we're getting really sleepy after we eat, there could be some of that reactive hypoglycemia or insulin resistance, metabolic syndrome. If we're feeling really energized, as I gather Jemma was, that's not necessarily a good thing. So we can have some of the signs of low blood sugar would be increased energy after meals, craving for sweets between meals, getting hangry if your meals are missed, dependency on coffee and sugar, getting lightheaded if meals are missed, feeling shaky, jittery, agitated, nervous, becoming upset easily, poor memory, forgetfulness, and blurred vision. So Jemma has a glucose issue. All right, moving down. Next functional medicine lab we're going to look at is, this is just normal labs that her oncologists run. This is no special stuff. And we want to start there in functional medicine. Too many docs in the area, and I am not one of them that does this. They get run right for the expensive tests that insurance companies don't cover. You got to start here. If you don't do a good job with this, you're guessing. So you've got to cover the basics first in functional medicine. So oftentimes there's a lot of work that needs to be done with just being a good doctor in general. Forget the nutrition stuff for a bit. You got to fix. This person's not going to be normal if her blood sugar is chronically running low, especially if they're recovering from a traumatic brain injury. Your brain has to have blood sugar and oxygen. If you're anemic and you're running hypoglycemic all the time, you have glial cell activation. You're not going to heal. So it's very important that we address just good old-fashioned just fundamentals of medicine first before we move into spending a lot of the patient's money on functional medicine tests too. All right, next, blood urea nitrogen. She is 21. What blood urea nitrogen is, it's called a BUN. We see this in kidney-related disorders, but what's interesting in the BUN, healthy is between 10 and 16. So if you see her, it looks like she was running between 10 and 16, but starting in about 2019, she started creeping up and up and up. So something has happened in through this area. It's just a slight tick, but she was in the optimal range between 10 and 16 here, and then she started to pop up. So the healthy range is between 10 and 16. It's elevated if there's kidney disease or dehydration. This is one finding of dehydration. There's other findings too, which we're not going to go into how we would know somebody's dehydrated, but maybe she started going to work and wasn't paying enough attention to her intake of water. But also, low stomach acid can be a cause. So if you're don't have a low stomach acid, you might not be breaking down your proteins very well, and that can elevate your BUN. Also, people being on a high protein diet. Was she on a ketogenic diet? Was she eating a ton of protein? Could it be a mix of both? Maybe low stomach acid, which interesting goes along with thyroid disorders. People who have thyroid disorders will tend to have not enough stomach acid. So with that, you get poor absorption of certain minerals, especially calcium and iron. You'll get some low B12 numbers, and that the BUN will start to creep up past 16. So, and she does have a thyroid disorder. So could it be that? All right, so we've got a little window into what's going on. There could be some not enough stomach acid to break down some of the proteins, or she could be on a high protein diet, or a little bit of both. All right, creatinine looks okay. Okay, where are we? Glomerular filtration rate, that looks good. Let's talk for a minute about potassium. This is really interesting. So, potassium, the functional medicine range is between 4 and 4.5. She's a 4.1. Take a look here. It's interesting. She did have a dip in between 2018, maybe halfway through 2018, 2019. So that was kind of nearing the time where she had her pneumonitis and was under a lot of stress. She had that side effect of radiation called radiation pneumonitis. And during that time as well, it lasted for about a year, and she was under a lot of stress. So maybe that can account for some of the dip in that. But her potassium's not low. We like to see it, once it gets below 4, a couple things can happen. The acronym is called a sick walt. Let me pull up. Let me see if I can pull up a browser here. Sick walt. There's a cool little, here we go. All right, a sick walt. Hopefully you guys can see this, but you get alkalosis, which you'll start to see changes in the CO2 level of her blood, which in fact she has. So, low potassium can cause alkalosis, shallow respirations, irritability, confusion, drowsiness, weakness, fatigue, cardiac arrhythmias. So it was during her time where she had radiation pneumonitis and pericarditis. What sent her to the emergency room multiple times was tachycardia, irregular rhythm, bradycardia, lethargy, thready pulse, You see a decrease in intestinal motility, nausea, vomiting, and ileus. So these people do not feel well. Interesting enough, I'll see patients who go to the emergency room for panic attacks, and I'll get the labs back, and frequently they're in the reference range, but they're on the low normal, below 4, in the mid to upper 3s. And a lot of times, and they can't find anything wrong with them other than they have some tachycardia. They're thinking they're having a panic attack, when it could be not enough potassium, which can cause similar issues. So you always want to be aware of the potassium level. So this is her current level. So I suspect she was decreased earlier. So anyway, we would keep our eye on that and ask her about things like, do you feel anxious? Do you feel like you've had some panic attacks? Does your heart race? Things like that. So, all right, chloride. Chloride's another good indicator for where her stomach acid is going. We like to see that over 100 in functional medicine, and that's fine there. All right, did I miss anything about potassium? Potassium can also be low when the adrenal glands sit on top of the kidney, and they produce both glucocorticoids, like steroids, as well as mineralocorticoids, and are involved in the regulation of sodium and retaining sodium and retaining fluids. So a high aldosterone level can lead to an increase in the amount of potassium that is secreted, so you can get low normal levels. Hers are okay. So I showed you the Sickwalt slide. So, okay, chloride, same thing. That's looking okay. Carbon dioxide, take a look here. So she is running on the high side. Now, we talked earlier about what the CO2 is. When it's high, you have to ask yourself the question: is the patient taking a lot of bicarb? Are they taking some bicarb because their stomach is upset, or they think they have too much acid, or they want to alkalize their body? Well, that's a little on the high side. We're not going to get into this on this video, but alkalizing is helpful for a lot of things, but sometimes it can stimulate inflammasomal reactions. So we'll make another video about what an inflammasome is, and it's recently been implicated in why people are developing some of the cytokine storms in the COVID-19 issue. So we want to be really careful with what we're doing with that. We want to eat a healthy diet. We don't want to overly go one way or the other. So the CO2 when high, are they taking bicarb? Have they been vomiting? When you vomit, you lose a lot of your hydrochloric acid, and your body shifts its pH. Also, carbon dioxide up like that can be from respiratory alkalosis. But and you also see that low normal potassium with that. So could this number be related to the chronically low potassium? So it gives us something to think about. All right, moving on to calcium. I'm going to finish this one, and we're going to have to make a third video because I'm trying to keep these videos under 15 minutes. Calcium, interesting. Her calcium level, I know on one of her labs was over 10. And that could be related to a number of things. So elevated calcium levels, once they're an adult, over 10, even though the reference range says 10.2. If we see consistently elevated over 10, we worry about parathyroid disease, and that's involved in the regulation of calcium in the bloodstream. In her case, it was a lot of dietary calcium. She was taking calcium supplements, as well as she has some high vitamin D, and that's come down under 10, and her parathyroid hormone is normal, which sometimes you can get some joint pain with that. And you also get bone loss. And she has a history of osteoporosis as well, bone loss. So we don't want to ignore that. If you have, not everybody with osteoporosis has an elevated calcium level. You don't really want to live and die by this calcium level. You just don't want it over, you want to keep it in the healthy range. So, okay, I'm going to stop right now. We're going to make a part 3.